This informational video will guide you on how to use the irrigation bath prescribed by your medical provider. But please remember that your doctor's instructions will always take precedent over any information provided in this tutorial. This video does not make any guarantees of results. When used properly and regularly, the irrigation bath regimen can be used to treat common and complicated foot conditions like ingrown toenails, cellulitis, athlete's foot, and other foot fungi, pitted keratitis, diabetic ulcers, open or infected sores, abscesses, joint infections, and bone infections. The irrigation bath also works well for other areas of the body that might fit into the bath, like the hand or elbow. The irrigation bath program can be used for preventative therapy when there is no infection present, or to be used to treat a current issue. This method can be used as a standalone therapy or as an add-on therapy to existing oral and injectable antibiotics to promote faster healing when tissue absorption is compromised due to poor circulation. Infections of the foot are traditionally difficult to heal due to naturally poor circulation in the feet. It can be difficult for oral and injectable medications to be carried all the way to the foot in effective amounts. Using a daily irrigation bath regimen can help cleanse the wound and remove dead tissue, help increase circulation in the foot, and the topical application of prescribed medications directly to the affected site can enhance the effects of oral and injectable medications. Monthly home delivery is provided with every irrigation bath program. Your first month's shipment will include a foot spa at no additional charge, patient instructions for cleaning and using, and 1 month supply of your prescribed medications. Each patient's therapy will differ based on your medical prescriber's preference and or what your insurance will cover. You may receive a compounded regimen that includes multiple ingredients in one or multiple ingredients that are individually packaged. To begin using your irrigation bath regimen, remove the foot spa from the box and clean with soap and warm water before use. Set the spa on a dry, hard, flat surface near an area where you can sit and soak comfortably. We recommend that you place a towel underneath the spa as it may bubble over. While the spa is unplugged, use a cup to fill the foot spa about 3/4 of the way full with water. Plug the spa into an electrical source and press the on button to start the foot bath. Allow the water to warm up for about 10 minutes and then add your medications accordingly. If you received the pre-filled jars, simply remove the small white cap and completely empty the contents into the water by depressing the plunger on the bottom of the jar. The medication should dissolve completely within a few minutes. Soak your feet in the medicated water for 10 minutes. If you receive the 3-part medication regimen, it will include antibiotic capsules, either an antibiotic ointment or antibiotic liquid, and an antifungal powder. First, remove the 3 antibiotic capsules from the pill bottle and empty the contents of each capsule into the warm water. Then you will either add the contents of 1 tube of the antibiotic ointment or 1 bottle of the antibiotic liquid into the irrigation bath. A silver key may be included if you receive the antibiotic ointment. It can be used to squeeze out any remaining ointment into the bath. Finally, add the entire contents of one of the antifungal powder bottles into the bath. We recommend that you fill the bottle with a little bit of the water from the bath and shake up the bottle and empty it into the bath to ensure all powder has been removed. Allow all medications to dissolve for a few minutes and then soak either your foot or appropriate body part in the spa for 10 minutes. If you received a single pill bottle of compounded antibiotic and antifungal capsules, then simply remove 1 capsule from the bottle and empty the capsule's contents into the warm water. Allow the medication to fully dissolve and then soak your foot or appropriate body part in the spa for 10 minutes. Some patients may only receive an antifungal based on what their medical provider is treating. This may be either an antifungal powder or an antifungal cream. If you receive the antifungal powder, then add the entire contents of 1 bottle into the bath. As mentioned before, we recommend that you fill the bottle with a little bit of water from the bath and shake it up and empty into the bath to ensure all powder has been removed. If you receive the antifungal cream, then add the entire contents of 1 tube into the bath. A silver key will be included to help you squeeze out any remaining cream into the bath. Allow medication to dissolve for a few minutes and then soak either your foot or appropriate body part in the spa for 10 minutes. After soaking, turn off the spa and unplug from the electrical source. Empty the contents of the spa into a bathtub or sink and clean the spa with soap and warm water after each use. To get best results, it is recommended to repeat this process twice a day. However, some patients find it easier to use just once a day. If this is the case, treatment time may be longer than normal. Your medical provider may prescribe you refills. While results vary, most patients may need to use this regimen for 3 to 4 months. Your provider will let you know when you can stop therapy. The pharmacy will call you each month to remind you of your refill, or you may ask the pharmacy to automatically fill and mail to you each month without a phone call. If you have any questions about this program or anything else, you may reach a pharmacist Monday through Friday from 7 a.m. to 5 p.m. Central Standard Time.